Okay, getting started. Then this is just an incredible opportunity. Thank you so much, Carolyn and Rick, for you guys putting this together. Is just mind-blowing. An opportunity to share some of my thoughts and my experience. I am known for usually over-explaining things, so I'm going to do my level best to be as straightforward and simple as I can. And if I leave anything out and leave a gap and people need more clarification later, then please send Carolyn through the chat. Send the question to Carolyn or Chuck or whoever's taking care of that part. And we'll get back to it if it's necessary. So Carolyn gave my introduction that I have been a physician, a medical doctor for 48 years. And yes, 10 years, I first went straight into obstetrics and gynecology, and I still am doing gynecology, yes, just clinical, of course, no surgery anymore. And then 10 years in, yes, a friend of mine gave me the gift of homeopathy because I had no idea it even existed. So she picks me up by the scruff of my neck and she says, Tina, she didn't call me Tina, she said Christina, you have to study homeopathy. It combines perfectly with your mindset. And I said, oh yeah, really? And I went to find out what it was all about. Man, can somebody fall in love with something and more than 40 years later be more in love than they were before? Guys, you have no idea what's happening in the world of homeopathy right now. Yes, COVID and everything else. So how come this fit in? Samuel Hahnemann, who developed homeopathy more than 200 years ago, had the whole thing set in place and documented and explained, minutely explained how to treat patients, how to make the remedies, how to figure out what's what, because it's a different language. It's so we talk about science and medicine. Yes, science and medicine. But there are a whole bunch of sciences and medicines, and they're all valid. They all have their place. And so what Hahnemann put together, he wrote down what his last edition of the Organon of Medicine is the 6th edition, where he gives us the most explicit explanations, and then he dies around 1840. So this was all set in place before the Baha'i faith was born. And it almost blew my mind. Look at Carolyn. She starts off our meditation, our devotional today with a prayer where she says from Baha'u'llah, purge me with the waters of thy bounty from all pestilence and I didn't get the rest, but I'm thinking, hey, did she pick that on purpose? Because, good for you. Thank you very much. Send me the little link later. I tried to find it here. I couldn't find it. So good. Anyway, what apparently is bogus, and I was very sad. I thought I was going to say, yeah, if you guys want to know what it's all about, check out this or that. Mainstream knowledge sources nowadays come up with a pseudo definition calling homeopathy a pseudoscience. I'm thinking, uh-oh. So I know where that comes from. Anyway, let's go back to the reason I got into all this, because Samuel Hahnemann says clearly that the reason for a physician to exist, his whole reason for his work and everything, is to help people be able to realize their highest aspirations as human beings. So curing isn't just getting rid of this or that symptom. It's to put people back on track to really, really become who they're supposed to be, who they're meant to be, their potential. And that ties in for me with the Baha'i faith, where it's very clear to me that we are spiritual beings having a physical existence. So this is one part of our one stage of our development in our existence, in our life. Like we, in our mother's womb, we had to develop members and organs and functions that weren't good for anything in there. Who would need eyes or legs or hands or anything inside a mother's womb? But, and then what we really wanted there was a good, healthy placenta and an umbilical cord and everything, an intact water bag and everything. When the baby gets out here, if it doesn't have all these organs and systems in order, we all say, oh, poor thing. Oh my goodness, it's going to be so difficult. So what the Baha'i faith teaches is that we're in the womb of the world here. And we are given the opportunity out of free will and our choices along our lifespan here to make the moral choices that help strengthen and put together our character and who we really are. The Dalai Lama was that was the Dalai Lama speaking in that one piece that you play quite often, wasn't it, Carolyn? No, well, anyway, whoever was speaking there talks about karma. So we don't need to go into karma from some other life. We make our own karma. We have to reap what we sow. And so as a physician, this is where homeopathy comes in. It's possible to help a person who has kind of gone off his track get back on track. Because when we have issues that disalign us from what we were supposed to be doing as spiritual beings, developing virtues and the qualities that will be our limbs and organs and help us have a more plentiful existence in our next stage of life. When we go off track, our body is our best friend, because our body will say, okay, I don't think you noticed you've gone off the road and you're on the side of the road there. You don't need a better shock absorber. You need to get back on the road, person. So what does homeopathy do? It gives me an instrument where I can bring in balance all aspects of a human experience, from the spiritual and the not substituting spiritual writings, but I mean putting a person back in contact with the spiritual and the emotional and the intellectual and all things physical, more than you guys can imagine. Even that's why I'm still in love, because every couple of weeks I get wind of somebody curing something that was supposed to be incurable. And I've seen that so often that I really, it really makes you feel grateful to be able to interact with people and this knowledge that's there for everybody. So when we get off our track and start to make physical symptoms, it's like the body can talk to us. When we have certain organs or certain kinds of symptoms, they symbolize certain emotions or things that are lacking, or things that are we're overreacting in some manner. And so it's like a body language. And homeopathy takes all these different aspects, the physical with all the details, and the way the person is, and the way the person reacts. And there are remedies that have been discovered through the scientific homeopathic means, which is all documented, like I said. And we choose one remedy that goes with the way that person is, the way the person is as a personality, the kind of child the person was, the kind of illness a person gets, how they react to the illness. So you can say, oh, yes, COVID is here. It's a terrible, terrible disease. True, in many cases. But what does homeopathy do? It takes each case, and doctors all over the world have figured out that about 8 or 10 remedies in homeopathy will cover 99% of cases of COVID and bring the person back to health in a few days. So it's I have a case personally. I'm not going out in the trenches. I'm in home office and quarantined and stuff because I'm high risk group because of my age. But I've kept on seeing patients online ever since the 20th of March when I shut down my office. So I've followed some cases and one very close. The person had their constitutional remedy, which actually 2 years ago made a difference between life and death from a situation of eclampsia in childbirth, where the mother and the babies would have definitely died if she hadn't had the support that homeopathy gave with her constitutional remedy. Because when I was able to visit her the next day, she looked like any other patient who'd had a C-section. I'm thinking, okay, that's not the way eclampsia works. It leaves the person as if they'd been run over by a tractor for days and days and days if they don't die later. And so, long story short, in 4 days, she and the 2 premature babies, everybody was well enough to go home in 4 days. And the doctor said, this isn't happening. The obstetrician who attended her when the babies were born, he said he'd never, ever had a harder situation to deal with. And here she is fine the next day. So this is the person who about 2 weeks ago is tested positive for COVID and sent home from work. And so she takes a dose of her own remedy, and she takes the one that we've been giving people monthly to try to prevent coming down with the illness itself, if possible. And so she takes it more often, and she gets in contact with me. And this is exactly when a brand new remedy made from the coronavirus itself, virus itself, was becoming available. It had just gotten into the pharmacies. And so the doctor who's really taking care of her, the primary homeopath, he said, give her some doses of coronino. And she said when she took it, it was as if it was night and day. She was feeling she could have been worse, she knew that. But she said she felt miserable and extremely tired still, and as if there were a hand mixing around in her chest and everything. And when she took this dose of coronino homeopathy, she said in a couple of hours she was 90% better, and she's fine now. So you can say, oh, that's what do you call it? That it's a coincidence. Not quite. No, there's scientific evidence. people want to look at numbers, I gave Carolyn a link to a short video that literally puts 2 plus 2 together, showing how it comes out to 4. For anybody who might be interested, Carolyn can pass the link on. And so basically I'm not, you know what, there's a documentary, a full-length documentary that's beautiful about how homeopathy works and everything. Carolyn knows the link too. It's called Just One Drop. Anybody can download it, for Pete's sakes. It's on YouTube. Just One Drop. It's a full-length documentary. So I'm not going to try to explain exactly how homeopathy works, but I'm really glad that Carolyn gave me this opportunity to share my life experience with something that really makes a difference. And if anybody's interested, it's there for whomever. Person has to see if they're interested or not. Carolyn, I don't know. I probably left a whole bunch of holes in that. I don't know what somebody would like me to elaborate on. Otherwise, I'll go on for 5 hours here. Okay, Eric, how does homeopathy work? Can I say that then? Can I answer Eric? Wonderful. So the whole big issue, no, the apparent issue, because the other issue is something else, but I'm not going there right now. The apparent issue is, well, we make double-blind studies, and this homeopathic remedy doesn't cure everybody who has this or that or the other. It's trying to compare apples to oranges or something like that. Allopathic medicine is anti this and anti that. And the rationale is, if you get rid of a pain or get rid of an infection or get rid of a whatever, the person's going to be fine, right? Not always. Because a whole bunch of times the person is ill because they weren't fine to begin with, like in urinary tract infections, not something you catch. It's your body whose immune system turns a blind eye and lets normal bacteria from the body take over. And so homeopathy works like this. It's as if I could give you an extra dose of Eric. In this case, I'm answering Eric's question. I could give you an extra dose of Eric because we have sat down and put together all the details of what you're like and what your urinary tract infection feels like to you and what it's doing to you and everything. And I'm saying, aha, that looks like a case of this or that remedy. So I give you a remedy that vibrates on the same frequency as you do. It's physics. It's not chemistry. That's why you can't compare apples to oranges, because it's not chemistry. You expect that if you have Escherichia coli, you give it norfloxacino, and it's supposed to kill all the Escherichia coli. But I don't know how you guys say that in English, coli or something. But what I'm saying here is, you treat a person who has a urinary tract infection. If every one of your patients has Escherichia coli, fine. But you're going to have a different remedy for each person, because each person is different, and they have unbalanced themselves for different reasons. Usually, urinary tract symptoms have to do either with anger, that I socked so fast that I didn't even notice I was angry, or fear, so deadly fear that I couldn't admit to myself that I was afraid. And then all of a sudden I start having symptoms. And then sometimes you'll get this confirmed with a lab exam, a lab test, which should be done absolutely every time. And it's not here anyway. But sometimes you'll find a bacteria in the lab exam, and sometimes you won't, but the symptoms will be of cystitis and urinary tract infection. And so allopathy gives everybody the 2 or 3 same medicines, antibiotics, trying to get rid of the bacteria. And each person reacts the way they can, because their root cause, whatever it was that permitted their immune system to let this come about, is different from one person to another. So trying to see if I can put this in a nutshell, Eric. How does homeopathy work? I, the doctor, look for a remedy that has to be prepared in a very, very specific manner. It's not just any old substance. It's not tea. Here in Brazil, people love to take tea for this and that and the other, and that's wonderful for a whole bunch of things, but it's not homeopathy. Never was. So you have to have the medicines prepared specifically in a manner that Hahnemann left for us long ago. And so you match which remedy goes with the way that person is. And when you got the right match, I guess people remember high school physics, acoustics and length of wave and amplitude of wave and stuff like that. So we're looking for the same wavelength in a remedy, because the remedy is always the same wavelength. But the person, what wavelength is this person, except I can't measure that. So I go by the symptoms which talk to me. And what remedy goes with this wavelength? It looks like pulsatilla, it looks like sulfur, it looks like lycopodium, it's like lachesis, whatever. And if it is the right wavelength, it'll be as if I were able to give an extra dose of that person's own energy, because it's like an orchestra. Is it nipe in English? What do you guys call when you got a whole bunch of in English too? Okay. When they play the same note, all the metals stand up and blow the same note from their horn. It practically brings the ballroom down. Or when you have Gregorian singing, where all the singers sing exactly the same note, it fills the church with reverberation, because you have added the amplitude. And so you have the very same length, and you add the amplitude. So that's what the appropriate constitutional homeopathic remedy does, Eric. It's an extra dose of your own energy. It's as if it were an extra dose of your own energy. So you have more wherewithal to deal with whatever's wrong. So coming back to my urinary tract infection. Okay, it was. I was in panic. I was so fearful of whatever that I couldn't even think about it. And so now my attention's turned to my bladder and all this pain and everything. And then when I use antibiotics, my fear is still there. When I take a dose of my constitutional remedy in homeopathy, I find another angle to look at the situation. It still scares me, I'll admit it, but I believe I can deal with it, whatever it is. But it's fear or anger, but usually fear and anger together. Anyway, I feel that I can deal with the original cause of why I got sick. So the psychological, many times, at least half the times or more, is let's say the beginning of whatever comes up as a symptom later on. But working from the symptom back and taking all these details into consideration, you can find one remedy that gives the person an extra dose of himself. It's psychosomatic. It's got all aspects of human reality taken into consideration, and that's why I fell in love with homeopathy, because I wanted something like that from the beginning. And my colleagues would say, don't be stupid. This doesn't exist. Just give them a prescription for whatever, for them to have it filled at the pharmacy, and stop worrying about people. And so I kind of kept to myself. And then my friend goes and saves me and brings me to homeopathy. And what I saw that day is the day I had my first contact is, hey, wait a second. There is a way to deal with the whole person. So anyway, did I answer, Eric? Is it okay? Okay, there. So whoever's keeping up with the
There are
chat.
several other questions on the chat. I
Yeah,
think
so
Jasmine
what
was the
other
next one.
question have I not touched yet?
Yeah, Jasmine was the next one. Then there was Ada, and then there was Anne.
Okay, what's it
Molly's
about?
daughter.
I lose myself when I try to keep on talking and read what's on the chat at the same time.
Well, would you rather that people raise their hand and ask?
No, this is fine. Just tell me what's next. What have I not touched on yet? Please.
Oh, okay. You want me to do that? Okay.
Oh, you or Chuck or somebody.
Okay, let me see here. Let me go back to the first one after Eric. After Eric, Jasmine. What does homeopathy say about how emotions manifest physically? Tina, I'm going to read a few of them because the answer might be similar.
That's what I'm asking
you
you to
might address all these things in one answer.
Yeah.
So how does
Half of that is already answered when I explained about urinary tract infection, but if it's not clear, I'll do it again.
Okay, then the next person is Deborah. Is there a list of homeopathic remedies you consider for COVID? Next one is Ada. What is homeopathy addressing? If it's not chemistry, is it biology, biomemory, energy, auric? I'm not understanding how it is analyzed. Is it addressing food, moves, environment? Is it similar to Ayurveda? Okay, you want me to stop here?
Yeah, stop here.
Okay.
Working back, it addresses your energy. It's energy field. It gives you more energy to do whatever you think is best. If you know what Ayurveda is about and you have access to it, then the appropriate constitutional homeopathic remedy will give you a condition that if you want to apply Ayurveda, you'll be in seventh heaven, because it'll be wonderful. It's not the same thing. They're different ways of treating health. So environment and diet, what do they call it here? Nutrição funcional, functional nutrition is individualized too, right, Carolyn? I'm not saying,
yeah.
Okay, so there are all these other aspects are part of human reality and part of our experience on this plane, and we have an enormous responsibility, enormous. So if this is here for us to use, we have to figure out what is using and how do we use it, and so all the environmental issues and all that stuff. A person who is balanced and not sick in one way or another can deal with all these other things much better. There is DNA, but there's epigenetics that also has to do, and there are tons of other things, and they all come together because the correct homeopathic remedy for an individual, it has to be for the individual. The correct homeopathic remedy will give this person clarity so that the person can see what's happening, and so that it can be more effective. Instead of punching somebody in the nose every time they get mad, stopping and seeing if they can engage in dialogue or something else. I mean, each person needs what they need. And when they aren't well, they get sick, like we're used to calling sickness. For the person, you put everything back in balance and the person has more clarity. So all these other issues have to do with the whole, yes. Something about constitution, something about diet. I don't know, Ada's giving a whole bunch of ideas. Yes, 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 yes. But where does homeopathy come in? It's an extra dose of energy specific to the frequency you vibrate on. Then all the rest can either fall into place without you even noticing how, or a situation that's very interesting happening to me personally right now. I took a dose of a remedy recently, and it's funny because apparently nothing's happening. But I noticed that my internal dialogue changed like that from one day to the other. I can't let go, I can't let go, I can't let go, I can't let go to save my life. And then all of a sudden, yes, I can. And I'm thinking, okay, I've never, ever said that to myself. Never. And so I'm beginning to, at my age, I'm beginning to figure out what does let go mean. And so I've got this and I've got that and I've got the other. And every day I get one or two more angles. Aha, yes, 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 I can do that. And that's so this is just me. You're looking for a specific remedy for each person. Somebody asked about COVID, a list. What we have been doing is in some parts of the world, they've been using Arsenicum album C30. I'm with the group of physicians, homeopaths worldwide, millions of people using by now, using Camphora 1M twice a day for 2 days, once a month until the whole pandemic is over. Heaven knows where it's going, how it's going to be, but this is the remedy I was talking about in the case that I mentioned, where the new remedy is available. It's not a panacea. It's each person will react the way they're capable of reacting to whatever the situation is. There's a list of 8 or 10 remedies that a homeopathic physician will use. Here in Brazil, we have about 500 homeopathic physicians lined up to quote unquote see patients online for free in homeopathy to help them deal with cases that aren't in the hospital anyway. But it's all in Portuguese, of course. But the homeopaths here in Brazil and the ones in India are really, really, I'm sure there's a bunch of people in the United States, but for a whole bunch of reasons, when homeopathy was really taking off in the middle of the 19th century, it started interfering with interests of some people. And by 1910, the homeopathic colleges were shut down. The same story, you guys know it. So it took forever for homeopathy. It survived. They're wonderful homeopaths in the United States, for sure. Really, really good ones. They know what they're doing. But there isn't a big number like in Brazil and India. So anyway, Carolyn, something else.
Okay, similar to Jasmine's question above, as Baha'is who consistently attempt to rise above stress in our lives through prayer, meditation, reading, inspiring writings, practicing gratitude, surrounding ourselves with positive people insofar as possible, getting exercise, appreciating nature, eating well, avoiding jealousy and anger, etc. How can that stress manifests itself in our health and perhaps make us sick in spite of all we do to stay healthy. You want another one, or is that enough for you?
No, that needs to be addressed, because when Rick was reading that we should avoid jealousy and anger as we would a lion, we have a dear friend who is now deceased from cancer. So anyway, when she was very, very, very ill, a psychologist asked her, please tell me about your sadness and loss that you've had. She said, sadness? I don't have any sadness. I'm always happy. Our dear friend hadn't understood the meaning. I'm sure she was basing herself on Abdul Baha's words, but she hadn't quite understood how you apply that. So exactly the words in the question you just read, we do everything we know how to do. Yes, 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 and keep on doing it. That's what we're here for. But when in spite of that, we fall ill or something, please try to remember that that is some kind of body language telling us, hey, there's a part that you don't quite understand. That's where homeopathy should come in, because it should give you the clarity to perceive from a different angle whatever it is you didn't understand or you thought you understood. Or like our friend, she would make a joke out of what we used to kid her. I mean, we used to say, hey, if they tell you there was an accident on the highway, you'll say, oh, how wonderful. That was us kidding her back when she was with us here. And because she would be happy at absolutely every single situation. So what I understand as a physician and as a homeopath is, okay, like Abdul Baha says, there's no time more appropriate for us to be happy in general, but we have to identify each situation. And if we suffer a loss, okay, we suffered a loss, we're sad for that, we deal with it, we don't pretend we didn't feel it. That's where the illness comes in. Anger and jealousy. If I pretend they don't exist, it will create some kind of a symptom in some part of my body. And if I just use an anti-whatever is created, the body will kind of say, okay, back off. I'm trying to help you, but you don't understand. You hit me over the head with it. We can't pretend it's not there. Like Pixel says here, we can't pretend it's not there. It is there.
Mm-hmm.
But if we're in balance, which is what homeopathy can give us, if we have clarity to understand what we're going through, and maybe even take a step back and get a little bit bigger picture, a different angle or whatever, that's what homeopathy is for. So I can say, oh, okay, so such and such is happening, and I've been reacting like this. But you know what? Even though such and such still keeps on happening, I don't have to react like this. I can find a different way of reacting. Like anger. Anger is for fighting, but do I have to fight against, or can I fight for? Can I dedicate this energy to something constructive? Can I stop and breathe deeply and take a big drink of water and go empty my bladder and think, wait a second, what can I do right this very minute that can help prevent this or mitigate that, whatever. I can't fix what's happening in Lebanon. No, I can't, but there's stuff happening right here. Do I see it? Oh, but this, I don't want to get my hands dirty here. So there's a bunch of stuff happening. And when we're off our track of learning to be human beings, remember, a spiritual being having a physical experience where we have the contrasts of right and wrong and dark and light and hot and cold and all the contrasts for us to be able to make choices. And the choices that are in line with our spiritual development will feel good to us. And anything that isn't in line will somehow or other feel bad, and I can acknowledge that, which is hopefully what I'll do to see what I have to learn from it. Or I can pretend it's not happening. It's not happening to me. I don't care, or whatever. And then my body will say, okay, what kind of a symptom? Let's see, she won't want to know anything right now, so let me make something that'll show up 5 years from now or 10 years from now. Because some illnesses take forever to get really going and really affect your quality of life. Things of spiritual origin need spiritual remedies, and things of physical origin need physical remedies. Yes, 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 and yes. Starting out with, I was in a terrible accident and I lost a limb, and thank heavens for modern medicine. Thank heavens for modern medicine, because I've got something that I can use in place of the limb I lost. So yes, thank heavens for allopathy and modern medicine, all wonderful in their place. It's the chronic stuff that they can't deal with. They don't cure. They don't cure migraines. They don't cure whatever. If I have, for instance, I'm sick because I got extremely cold and I didn't have appropriate clothing to protect myself, and so it was physical. Yes, then a good hot tea and a good hot what's a scaldapes, Carolyn?
What's what?
Is scaldapes, Tracy? What is it?
A hot bath?
Not a bath, huh?
A hot foot bath.
Yeah, a foot bath, in the sense that if you put enough times hot water in your foot bath, then you finally get so hot you want to take all your extra clothing off. If you go into a hot shower, Carolyn, that's why it's not a bath, shower. If you stay too long in the water, the hot water, it'll burn your skin. It dries your skin out, and it makes it itch, and then it gets infected because you've been scratching it. And so the foot bath is what I'm talking about. That's something physical. Yes, it makes a difference. But homeopathy comes in for all these other situations that it's not so easy to put back in order. Not so easy to bring to balance. Serious stuff or chronic stuff.
Okay, so I think you've probably answered or agreed with some of Ada's comments, so I'm going to move to the next one here. From Artis, can you give a list of COVID medications?
The list that I can give is Camphora 1M and Arsenicum album C30. If you
the camphor,
not to treat, to prevent. Try to prevent.
Okay, Tina, the Camphor 1M is what Rick and I are doing. So I can, whoever is interested, let me know, and I'll tell you what we're doing and have been doing since March as a prevention for COVID. Now, the other remedy, Tina, I covered you up with my speaking, so go ahead and say it again, and then write it and text it to me, please, and I'll send it out to whoever wants it, because if you just mention it, I'm not going to remember.
Okay, fine, but I mean, it's not like it's better than the one you have. So as far as I'm concerned, the one you have is good enough. The thing is, whoever asked, the thing is to treat the infection itself. then you have to individualize. It's not a list I can give you because you wouldn't have the slightest idea. I could tell you the names, but I'm not going to because you wouldn't have the slightest idea how to use them. You need to individualize. You have to find a homeopath who can individualize how you're dealing if you're already sick. Now, to prevent, it's fine and dandy what Carolyn has the prescription in her hands. That's what everybody worldwide is doing. Almost everybody. Some
Okay.
are doing the other one, but don't worry about it. Don't worry about it.
Okay, next question is from Dina. Hey, Dina, I didn't see you, but it's great to hear you and know you're here. She's my niece in North Carolina. Sorry. There are other areas in medicine where energy is beginning to be recognized as a treatment for illness. For instance, in Lyme disease research and research for pancreatic cancer, AMP coil uses pulsed electromagnetic field to induce electrical magnetic current into damaged cells. Do you know if treatment like this has been explored for COVID? Does homeopathy explore technology to aid treatment? I'll let you answer that and then we'll come back to the next thing.
Yes. Energy is energy. However, whatever form of energy you know how to deal with, more power to you. If you're getting results, consistently getting results, thank heavens. Now, homeopathy is what it is. The studies nowadays with the help of computer science are expanding in such at such a rate that I personally can't even keep up with it, but I'm doing the best I can. But I mean, it's just mind-blowing what homeopathy can do within the parameters of homeopathy. It's not going to branch out and do something else. It is what it is. It does give you a dose of energy specific to whatever similarity is taken into consideration here. That's what it is. Homeopathy isn't going to go explore something else. A specific physician can if he wants to. I'm not going to, but I mean, I have colleagues that I know of that deal with other forms of energy along with homeopathy, and that's fine. That's the way they practice medicine. And so whatever is honestly making a difference, thank heavens for one more instrument to help people back to health, not just trying to cut out what's wrong, but bring them back to health.
Okay, let me go back to the chat here. Let's see.
I saw Dina someplace, I think it was Dina, say something about Sumbukus. Whatever she asked about, what I can tell you is in homeopathy, that this specific substance, I think she says it's elderberry in English, this specific substance, it has to be prepared according to a certain technique, and it has to be identified according to a certain technique as to what it can do as a homeopathic remedy. That's why I say it's not tea. So if somebody's taking elderberry tea for something, fine, but it's not homeopathy.
Okay, and here's another question.
It has been included officially, yeah.
Here's another question from Dina, which I actually like because I've wondered about this too. Actually, I know it kind of works because I've had issues before. Okay, do you feel anyone is mentally capable of correcting their energy? What can be done for people whose physical state is so destroyed by their mental state that there may not be enough time to correct their mental state in time to heal the body? Sorry, that's not exactly what happened with me, but. You want me to
Okay.
repeat it?
No, no, no. Thank you, Dina. Anybody who's trying their level best to grow the best they can, they'll deal with their issues up to a point, and they'll see that they've grown, and they'll feel that they're more mature, and interactions, and they'll have health and everything. It's when it's too much that homeopathy comes in. Because I personally like to say, you don't try to cure somebody who's not sick. Hahnemann says, pay close attention. What is to be cured in your patient? What is actually out of sync and needs curing, and what's either his characteristic or it's cultural or whatever. So as long as the person is able to deal with whatever, Dina, that's the way it's supposed to be. That's growth. That's life. That's becoming more mature and everything. It's when the person just can't do it on his own. That's where homeopathy comes in. And yes, homeopathy has some remedies, believe it or not, can practically bring you back from the grave, almost. There is some incredible it's not, consequences isn't the right word, but results from the use of this or that remedy, if it's the appropriate remedy for that person. If the person vibrates on the frequency of that remedy, then that remedy is going to pick that person up. In a sense, I was telling you about the case of eclampsia in this person I know. Thank heavens she had the right remedy, because boy, oh boy, that's really, really nasty. So, and it could have gotten even worse. And she was fine the next day.
Last question for me. Oh yeah, here's the one on Sambucas. You've already answered okay, Mojda, who's a nurse here, you've met her before. Do you personally treat patients, clients in another country with a chronic illness?
Oh, Mojda. It's funny you ask, because I have a couple of patients in the United States and a couple in Europe. So I've got somebody in Portugal, somebody in France, somebody in, it just happens, somebody in Ireland or something. It seems to be happening, and I wasn't into online stuff. I wasn't doing things on Skype back before the quarantine, but since I'm seeing patients that live 3 blocks from me online, well, what's the difference if I see them on the other side of the world? And so it's really neat. Yeah, I do.
Okay, let me go to the next thing here. Okay. What do you use to measure? Oh, what do you use to measure what needs to be addressed? I think you already answered this from Ada, or maybe not.
Kind of.
Okay, let me just read the whole thing here.
Okay.
Because you can always heal the mental state by changing diet, exercise, energy, environmental factors, financial conditions, etc. We need to know what is causing the illness. Can't we do that on our own? What conditions are being limited, oppressed, ignored, abused, and abandoned? Can you give one example of how to address a condition? I need to understand this in a concise manner. It seems like too many circles to address one problem. Okay. So.
Okay. Let me see if I can, Mission Impossible. I'm going to try to make a straight line here. we are spiritual beings having a physical experience on a plane of existence where there are contrasts, where we are given free will to choose which whatever we're going to do in each situation. Now, choice can come from our unconscious mind and can have generations of baggage, because everybody knows that a baby goes through whatever the mother is going through when the baby is in the womb. And the baby is only going to have a vague inkling that the mother might be another person when he's 8 months old. And so whatever I'm carrying, part of it is what was happening with my mother while I was in her womb. And we also know that a person goes through each stage, one line here, each stage of their own development through each stage of the development of each one of their children. Each one of their children. So while I'm carrying stuff from my mom is a baby again. And so as a baby again, she's carrying stuff from her mother, and then that goes way back to the beginning of time. So there are layers and layers of layers of stuff that might be in my unconscious. So I might make a choice, yes, but coming from my unconscious. That's where the bounty of physical illness comes in. What did Rick read? That sometimes physical illness helps us draw closer to the spiritual aspect of things. Because if I become physically ill, it might tip me off to what's off balance, and then I can go on my own, I can go deal with it. When I am not capable of doing it on my own, either I'm suffering from the physical, the emotional and psychological aspects of whatever it was, or I get physically ill. So physical illness is a language, a body language, giving us a tip, what might be off balance. And I don't have any sadness. She didn't want to deal with it. An appropriate homeopathic remedy for an individual, if it is the appropriate remedy, will help somebody like her say, okay, I've got so much sadness in here that I actually don't know what to do with it. It's, it'll help a person get closer to whatever the issues are that they have to deal with. That's where homeopathy comes in. So I don't know if I went around in circles again or if I answered, maybe. Anything.
Did she answer you, Ada?
There was a last phrase, Carolyn. There was a last phrase.
Okay, let's go back here. Okay. Okay, let me go. Can you give one example of how to address a condition? I need to understand this in a concise manner. Choice versus factors that are beyond our control. What we learn, how we learn, what we understand, how we understand. Generational DNA imprints which are unconsciously manifested, not facing real factors. And who and what is contributing to those factors or conditions. I think this is more a comment than a question. But
yeah, but I think I did address it because she wanted one example. I think I gave the example of urinary tract infection that comes from a fear or an anger that I didn't recognize. Because if I had recognized it and dealt with it, I wouldn't have my urinary tract infection. But since I didn't, because my unconscious thought it was just too much, completely overpowering, I can't deal with this. So the body says, okay, I'll help you carry it. give it to me and I'll see if I what kind of if I do a bursitis, and so you can't sock anybody in the nose, or if I do a urinary tract infection, so that you're so entertained with, that's not the right word, you're so pestered by the symptoms that you can't think of anything else. So as long as we recognize what's happening and deal with them the best we can consciously, we don't get sick. When we get sick, it's because some other factor is in the field here. Either that blast of freezing cold wind knocked me off my feet. It could be physical, yeah, okay. But usually it comes from inside, because I don't want to recognize I didn't feel what I felt, or something like that. And then the body says, okay, I'll help you deal with it then. I'll carry it for you for a while.
Okay. Let me see here. Oh, she added, what I mean to say is that anger may come from a financial impossibility and not a chemical biological condition.
But how did you get into that financial impossibility?
An impossibility that others are ignoring, abusing, passively, aggressively creating. Speaking on mental illness. Okay. So did that, where'd Tina go? She disappeared. Oh, here she is.
I'm right here.
Yeah, Tracy took over the screen for a minute. Okay, so go ahead. Anything that you want to add to that?
Okay, if I'm still there on Chuck's screen, am I? Well, anyway, basically, when in a homeopathic consultation, we start going round and round and round because this and that and the other is happening, and such is affecting me like this, and they're doing this and they're not doing that. And so it gets to the point where the homeopath says, wait a second, okay, fine, yeah, all these things are happening. What's happening inside of you because of these things? And that's where I have to go to decide which remedy will help this person, give them another dose of something that vibrates on exact same frequency. So all these things are happening. Yes, they are. Yes, they are. But what's happening inside of you because of these things? That's where I go for the similarities to find the remedy.
Okay, there are no more comments in the chat. Does anybody have any questions they would like to ask? I can't see everyone, but I'll just make my sister smaller again so I can see the gallery view, and then you can lift your hands and I'll call on you. Let me see, how do I do this? Gallery view, okay. Okay, oh, nice picture, Sarah, Dina. Okay, anybody have any questions? If so, raise your hand and then I can call on you.
Actually, Ada's right. I have to agree with her. There's nothing that I can point at that doesn't make sense in what she said. I mean, if you're in a toxic environment, it's toxic environment. If you don't have access to alkaline water, you don't. And those are facts, and that's true, and that's the way reality is on this plane of existence. Some things are the way we'd like them to be, and some things aren't. Absolutely everybody. I mean, somebody who doesn't live in a toxic environment, who has alkaline water and everything else, might have an issue. Maybe their mother has Alzheimer's or something. There's always something. Absolutely everybody has trials and tests and difficulties to deal with, and that's part of our growth on this plane of existence. Now, having said that, which sounds like I'm just poo-hooing what she said, and I'm not. It's just that that's part of the issue. In homeopathy, what would I do with somebody in a situation like that, that's suffering? When a person can identify what seems to be wrong or what's bothering her or what. Sometimes a patient will come to my office and say, when I had an office, and say, I've got this and that and the other. And then they'll go on for half an hour with a list of things that are bothering them, pestering them. And I say, okay, that's okay. I've got it all written down. Which of these things bothers you the most? Which makes you really suffer? So the patient picks out one, which is top priority. And then I go in with the patient to the experience of what it's like to be that person in this situation. What does it feel like? Describe what's going on inside of you because of this and that and the other that are facts. It's true. But how does this affect you? Because you are one person in the situation, and lo and behold, there are other people in a similar situation, and they react in a different manner. And somebody can say, there's absolutely nothing I can do. There's always something someone can do, but if the person can't see that, she is stuck. And that's one of the characteristics that I'm going to identify when I'm putting together the spoken portrait of the way the person is, to find the remedy that combines with that kind of person. And a person who gets stuck is quite common, actually. And there are hundreds and hundreds of remedies to help a person like that, but you have to choose the specific one that's where we go into the details of how does this affect you, what happens inside of you, what's the experience, describe what it feels like, stuff like that. So that's why I can't give a list of something for somebody that asked. That's what I answer, Ada, because some things are out of our control. That's part of reality. Yes. How do I deal with the fact that some things are out of my control? How does this affect me? That's where homeopathy comes in, to help put the person back in balance so they can see a way out, so they can find a different way of dealing with it, so that they don't have to suffer inside. It's the suffering that homeopathy is pathos, right? That homeopathy is looking to deal with.
So why give medicine and toxins to treat as opposed to forcing the system to change the conditions?
That's the ideal.
Okay, wait a second. Are you sure you want me to answer that? Because I can answer it.
Go for it.
Okay, the system. Everybody knows what the system is. And the system is going to keep on. That's where the medicine's against this and that and the other. And putting a lid on homeopathy. There are countries where homeopathy is against the law, guys, where they have actually literally proven that they have falsified reports about the efficacy of homeopathy. You guys check into the stuff that Carolyn can give you a link for. It's very interesting. It's eye-opening. Anyway, so homeopathy does exist. It's available. You can get remedies wherever you are. So the system is interested in maintaining status quo. And blah, 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 all the rest about the system. Change the system. That's what Baha'is are doing the world over. We are a microcosm of humanity, literally dedicating our lives every minute of every day to putting into practice spiritual principles. How you go about helping children understand equality of men and women, the illness that the racial and other prejudices are, the problems from extremes of wealth and poverty. There are actually ways to make a difference. It's all in existence. It's all within what is arcaboso? Somebody help me. Arcaboso. Somebody.
Conceptual framework.
Conceptual framework of what the Baha'i faith has brought to humanity. It's there. It's for everybody. Look into how to apply the Baha'i faith. Look into what's happening in all parts of the world. That's changing the system. Now, it's not overnight. It's not magic. It's not magic. There's a ton of work to be done. And each individual has opportunities, millions of opportunities of making moral choices that can help contribute to the solutions, or just, oh, there's nothing I can do, too bad, it's their fault. Oh, yeah, guys, I'm sorry. The basis of this, we have been brought up culturally, all of us, for centuries and centuries, maybe not quite from forever, but anyway, to believe that for one to win, the other has to lose. We have been educated to condone war. We have the illusion that somebody else can make us a victim. As long as we have this illusion that I'm a poor victim of this or that or the other, I keep on acting the way I've always acted and being a cog in a wheel of some whatever. It's when I decide to be myself, when I decide to make a difference, to row in the same direction of where humanity is going, really going, not the illusion of all that's falling down around us. Yes, things have to be changed, but they are in the process of being changed. My part, my personal part, is helping individuals get back on their feet, get back to feeling themselves, get back to being able to be a part of the whole thing, of the solution, not whole thing, the solution. Be a part of the solution because of the clarity that comes when you're feeling yourself again, not desperate in panic or under your bed in fear or whatever.
I just wanted to just tell the world what incredible sisters I have. Every time I listen to them, I become the wiser. Tina, I really, really got so much out of this talk, because for 40 some years that I've known you as a homeopathic doctor, in addition to a gynecologist, I still didn't have a clear enough understanding of how it works and how it relates to people. But especially when you were talking about how you try to diagnose each person's experience in terms of how they are dealing with a particular challenge in their lives, and then from their experience you try to reflect on what can you learn from them that may be appropriate to them. And then from that learning, you conceptualize and identify specific things that can help them, or medicines that can help them, that will generate a new experience in their lives. That to me is called the learning cycle. And I use that as an engineer in so many problem-solving scenarios of life, but I saw you articulate it in a way 100% focused on medicine and health, and helping people apply that learning cycle in their own process, in their own existence. And there's times in people's lives where they're not capable of doing that for themselves. And I understood you to say that those are specifically the times where homeopathy can help them if they have a skilled physician, a skilled facilitator who is helping them do that learning cycle to find a cure to their own situation. I just got so much out of your talk today. It was really, really eye-opening and a real pleasure. I'm one of the most blessed men in the world to have 5 awesome sisters who continually teach me new things and help me grow. I love you and just wanted to say that.
Well, thank you very much then. Thank you for the opportunity, Carolyn.
You're welcome. You're welcome. Hey, Chuck, you probably should quit the recording in a few minutes because you've been recording the Q&As too.